to Family.Inc Expert Interviews. Today, I have the pleasure of speaking with Ruschelle Khanna. Today's discussion is titled Walking on Eggshells, Managing Borderline Personality Disorder in Your Family. Ruschelle, welcome. Thank you for joining us.
Hi, Josh. Thank you so much for having me. I'm really excited about this discussion today because it is so under discussed, especially in the family business world.
Under discussed and over witnessed as an advisor for families. So I appreciate it because it helps me. And I think as I think about our audience, it certainly will help a lot of them. Before we begin, quick housekeeping. If anyone has any questions during the session, please use the Q&A button at the bottom of your screen. Ruschelle, you've got an interesting path to the work that you do now. And you have an upcoming book, Inherited Trauma and Family Wealth. Help us understand kind of the arc of your career, how you got here, and the work that you do.
Sure. Wow, beginning of my career, I've been doing this over 20 years. So I moved from Southern West Virginia to study at Columbia University. I got my degree in social work from Columbia. And then I was going to do public policy and community work. But then after I graduated, I ended up in a couple of different jobs. And one of those jobs was working as a private therapist for a wealthy family in the New York, New Jersey area. And I worked for them for 4 years to mitigate the result of sudden wealth within the family system, and also inherited patterns of trauma. I didn't know at the time that that's what I was doing. So
You inherited that that responsibility as well, huh?
Yes. So I worked with that family for several years and was able to help put their adult child on a path to autonomy and self-efficacy and health. So that was an interesting introduction coming from, I came from a very rural place, and our problems in Southern West Virginia look a little bit different. So the financial traumas that are here where I live again now are different, but they also overlap. So throughout the rest of my career, I ran substance abuse clinics. I then contracted Lyme disease and was out of the workforce for a while. And then when I came back to work, I came right back into specializing and working with chronic illness. And just because of where I was in Manhattan, Long Island, Connecticut, Lyme disease is acknowledged as an illness of privilege, or it has been, because a lot of times those families are the only ones that can receive proper treatment for that. So a lot of my work there was in-home work with families who have chronic illnesses and developing plans for them, as well as providing trauma work. So all of that kind of culminated, and then COVID happened. And I decided to move back to West Virginia and focus primarily on this overlap between wealth and health. And that's where my focus is now.
That's fantastic. Given the fact that we're talking about borderline personality disorder, can you talk to us about what that is, what that looks like? There's a lot of flavor around all of that. So let's start to frame up what this looks like, because I think it's there are a lot of families that are dealing with this, whether they've put a label on that, not put a label on that, but I think it's important to understand, what are we talking about exactly?
Sure. So if we start from a very high level of what is a personality disorder, the DSM-5 now defines personality disorders as a kind of an enduring chronic pain, emotional pain, and way of relating that is outside of the norm, the culture norm.
Mm-hmm.
and within that is borderline personality disorder. So borderline personality disorder is characterized by a lot of chaos, emotional chaos, impulses to hurt oneself, sabotage. I like to describe it as chaos and emptiness.
Mm.
Are kind of so chaos and emptiness are what the person with borderline experience is feeling on a daily basis. They're extremely isolated. There's actually a couple of images that I remember when I was taught about borderline personality disorder, the professor at Columbia, he drew a box. Actually, I drew you a little picture here. I
Oh
don't know if you
yeah.
see it. He
Yep.
he drew a box with a little dot inside. And
Huh.
he said, you see that in there? This is, if we were out here, you and I, this is like the rest of the world. And this is the person with borderline personality experience. They are so isolated and alone and separated from the rest of the world emotionally that it's a really, really scary place. And that really hit me with a lot of empathy for individuals who chronically live with this experience. You know, they try to connect, they try to have a sense of identity, and usually it doesn't look very pretty to families. It can look like rage, it
Mm.
can look like destruction, you know, anything that you would not want to happen in a family or a family business is what you could be up against if someone is experiencing a borderline state.
The idea of that isolation, I assume it's within the family, within society as a whole, they are feeling isolated, and so their way of sort of manifesting or exhibiting that could be any number of things, as you said, rage, destruction, manipulation, things of that nature as well.
Yes. So I think the best way that I've found to describe it to families it is, and this comes from the research too, is that
Yeah.
if you think of an under three, a 3-year-old and under, if you put that emotional experience into an adult on some level. So we all
Yeah.
have different parts. You know, people with borderline personality, some people function very well. So I don't want to kind of minimize their experience down to a trope of what this
Yeah.
is.
Yeah.
However, the pain that's associated with it is a tantrum, is the pain that a 3-year-old feels when their mother has left for too long. Uh,
Mm.
it's a deep, fragile pain that a really highly functioning person can be feeling at the same time that they're, you know, helping run the company.
How would you often hear, and I often see with my clients, it's really difficult to deal with so and so family member. And how do you know whether or not we could define this as borderline personality disorder versus just a challenging individual to deal with?
So borderline personality is quite difficult to diagnose because it it sits at the center of a lot of other health and mental health problems. So people with borderline personality, they may exhibit alcoholism to cope. They may have fibromyalgia because of the pain. We could talk at length about the way they experience pain. They're more susceptible to chronic illnesses.
Yeah.
So in terms of diagnosing, I think the major thing for someone to look at, if they can spot someone in the family that has a tendency toward black and white thinking, it's either this or it's that. You're either a good, you're either helping me or you're hurting me. Uh, So that comes from when we're little, right? If we think about how kids respond, you're either the good mom or the bad mom.
Yeah.
I don't have the subtlety. So I'd say the black and white experience is probably the most definable, even though there's a host of other things.
Yeah. How have you seen this manifest and the implications within families, enterprising families in business? Your clientele, high net worth individuals, families, oftentimes they have family businesses. Let's talk about what that looks like.
Sure. So before I talk about my experience, I do want to say there is very little research on mental health in family businesses.
Hmm.
In general, I think the one thing that we can confidently say about family businesses is that there are boundary challenges, there are boundary overlaps, and then there are challenges with um, next gen, third gen, feeling legitimate
Hmm.
and competent, as
Hmm.
opposed to being accepted and having a role within the family. So that those are the kind of two big factors we look at when we look at healthy family businesses. Is
Hmm.
everyone satisfied in a role? They know who they are, yet they have the freedom to kind of be themselves outside of the family tribe.
Hmm.
Um, So when we look at mental health in that system, we can also look at what happens in regular corporate. So in regular corporate, you have a different set of boundaries because you clearly know that well, I'll say you clearly know that your boss is not your mom or your dad, but that could probably be my next book because there's a lot of projection where no, I'm pretending that my boss is my mom or my dad and I'm acting those things out.
Yeah.
But we look at what the boundaries are within the family business system and how well are people sticking to those boundaries. And boundaries are the most important thing that you can have with someone who has a personality disorder.
Mm.
Um, because again, like a toddler, they like them, but they don't, right? They're conflicted about you're telling me this needs to happen. I don't like it, but I'm going to do it because it also helps me feel safe.
Yes. So let's get concrete on boundaries. Help me understand in this kind of like what are boundaries for a family in a family business? Or
That's a
maybe
good,
better said, what should they be?
well, those boundaries, unlike cultural norms, where in most office settings, right, like we know what boundaries are. But family businesses have this inherent boundary conflict. So every family business will operate a little bit differently in terms of boundaries.
Hmm.
In terms of concreteness, though, having family businesses go back to the basics and not forget that they are a business while they're at work. Like recently, I had one client say, um, her father, who owns the company, said, I'm putting on my boss hat now. I'm taking off my dad hat and I'm putting on my boss hat. And this is his adult daughter. And I thought, this is so good. If this is how you've operated that relationship throughout the years, that's a clear, simple thing that a patriarch can do to say, this is how we're talking right now.
Hmm. Being defining the role that you're playing in any given moment, whether you are I think about Rochelle, the four-room model and the idea of which room are you in a family business? Are you in the owner's room? Are you in the management room, the board room, and so forth, or the family room? And being able to define and clearly articulate what room you're in at any given point and playing that role. There are times when you need dad and there are times when you need boss. or mom and boss. And so the healthy version of that is being able to distinguish those and being able to articulate that to your family and colleagues and so on and so forth. Is that right?
Yes, and because individuals with a personality disorder are very sensitive to words, it's very helpful to
Hmm.
say that and to clarify that. Um, and when I say sensitive to words, I mean they if you think of someone who's insecure,
Mm-hmm.
right? If something is said that might sound a little off, it could hurt a lot more than someone who has a clear sense of themselves and feels secure. So defining those roles is helpful.
We talk about walking on eggshells. I can imagine, and I have seen where families struggle um, to say the right thing and knowing what to say so that you don't set somebody off, right? That happens all the time. Happens all the time, and it's only more sort of pronounced in the context of a business because you're trying to run an operation. You have teams around, and you're also family in there, and by not actually addressing things and defining roles and so forth, it really gets messy fast.
Hmm. And as you're saying that, Josh, I'm hearing in my head, maybe someone in a meeting people aren't always perfect in their communicating. And a response from a family member could be something like, oh, just don't be so sensitive, right? Like, I didn't mean it like that. Like, stop being
Yes.
so sensitive. So stop being so sensitive is the worst thing that you can say to somebody with personality disorder. It's
Yeah.
insulting. I mean, if for anyone, it's like not great, but it's especially insulting for someone who is really working hard not to be sensitive. I mean, they're trying internally really hard not to be so sensitive.
Interesting. They're working really hard to not be sensitive, but they can't help the fact that they are very sensitive. And so when those words hurt and cut through, it impacts them at a much greater level than somebody who does not have that personality disorder. Is that right? Or borderline?
Yes, it would be yours. You saw me as incompetent. I was worthless in that meeting. I mean, just let's go ahead and take it to the extreme.
Okay, so that black and whiteness was I didn't do something right in this meeting and now I'm worthless.
Yeah.
Got it. Or I did do something right, so now I'm king of the world, and why not get the raise today?
Yes,
And this
exactly.
vectoring back and forth and back and forth.
Hmm.
Okay, so we talk about roles and boundaries. How do families cope? How do families deal and navigate with this? Because it's a lot of mental and emotional energy on top of running an organization which could have hundreds or thousands of employees, and you're dealing with this.
Well, if it has come to a point where it is a major problem and someone is chronically doing things and acting out, then that probably says that in the family system, other people are not holding boundaries. Other people are placating and hoping it goes away. They're people pleasing, they're avoiding conflict, they're
Mhm.
lying, they're doing anything that they can to not address holding a boundary. And holding boundaries is a practice, and it can be really hard if you're not used to doing that.
Yeah, it's hard enough with kids, much less grown adults who are your peers and your colleagues working together and holding those boundaries, because I would imagine oftentimes it's easier to just ignore it and just focus on the things that you can control versus the things that you can't control, which might be your brother, sister, father, mother, whoever it might be.
Yes. So I want to, Josh, I have some resources that I don't, maybe we could share at the end of this, but
Yes.
on that topic, one of the books, Walking on Eggshells was also a book that I did not write. Most people are familiar with. That's the old standard borderline personality book, been around for many, many years. This one also has been around for many years. I Hate You, Don't Leave Me.
Fantastic.
So in this, I want to share kind of their key, simplified but important to practice way of addressing someone. And
Cool.
that's the setup method. So the
Okay.
setup method is we want to support, provide empathy, and truth. So the three words are we want to provide support, empathy, and truth. And what we mean by that is, I'm support words, right? Like, I'm here for you. You're not here alone. You're not doing this alone. Empathy. I understand that this could be painful for you. I understand that what I said in the meeting could have hurt really bad. And then the truth. And the truth is the one that most people are actually. So this whole setup method is like, I supported you, I provided empathy, and now I'm going to give you the truth, which is, but you still need to participate in the meeting the way your role defines. So just the way we would a child, right?
Yeah.
We're present, we provide empathy. I understand you're feeling hurt, but you still have to go and clean up your room. So
Hmm.
the truth is the truth. And a lot of times families don't want to go there.
The truth piece is the hard part
Yeah.
because they're afraid or concerned about, if I speak the truth, it's going to set this individual off again. And now I've taken one issue that I have to deal with, and now I've turned that into two issues or three or four and so forth.
And the reality is, in the short term, it might do that. That's
Yes.
why you might want to get some help in role playing. I do a lot of role playing around negotiation and mitigating. So I would work with one family member. My sister is difficult. How do I phrase this? How do I say it that is respectful and is effective?
So this is, if I think about working with a family member with borderline personality, uh, this is not sort of a, while I throw up my hands, this is a lost cause. It's just going to take effort. And you can work on this to help build the muscles and the skills to begin to help them see sort of the gray in between the black and white. Is that right?
Yeah. And if you're someone who has been diagnosed with a personality disorder or thinks maybe this fits you, I mean, I think there was a time where it was kind of like there's no treatment and you're kind of doomed because you have a personality disorder and personalities cannot be changed. But we've moved way past that. And there are a lot of treatments for personality disorders. And I really like to work with the family system because of the inherited trauma piece, and that a lot of times mom has struggled with personality disorder, grandma has, and there's a much richer healing that can take place that then just gets manifest in your business.
Mm-hmm. I can understand that. Um, well, and as I think about support, empathy, and truth, while it's more pronounced in this situation, that's great. That's great leadership and great management for any colleague, right? For any employee, and being able to say, "Hey, I'm here for you. I know, like, you may be overwhelmed. That has to be hard, but we have to get the project done." Uh, and it really applies across the board. So learning those skills is really helpful for anyone, frankly.
Yes. So dialectical behavior therapy is a skill-based treatment for borderline. It was developed for borderline personality. However, learning the skills of DBT is, to me, one of the top things that you can do as a manager or a boss to be emotionally equipped to deal with teams. I use the skills from DBT a lot in executive coaching with people who do not have personality disorders. So the setup method is not necessarily from DBT. It's from that book, I Hate You, Don't Leave Me.
Yep.
But dialectical behavior therapy has another great one that I use all the time. And it is for if someone is in a lot of emotional pain. So the actual person who's experiencing the pain. And it's called TIP.
Mm-hmm.
So TIPP is a process that, and again, this can go for everyone. So I'm going to walk you through TIP, and then you can let me know if this wouldn't just make a really cool morning routine for anybody that you know, because I think it does.
I love it.
So the T is, let's say you got enraged in a meeting and you're out of control and now you're in the bathroom and you're really upset. T, the first one is I'm going to temperature regulate. So I'm going to put something cold on my face or my neck. I'm going to splash cold water on my face, put ice on my neck. And that is for that vagal stimulation. I can explain that a little bit later, but first is temperature. I'm going to get cold.
Okay.
I is for, in broad terms, intense exercise. But what that would mean if you were at the office would be, I'm going to take 5 vigorous breaths. So just kind of a little hyperventilating, just like 5 big, deep breaths. The first P is progressive muscle relaxation. And how we would do that at work is we would just tighten our fists and release. Tighten and release for a few times.
Yeah.
And then the last P is paced breathing. So I'm going to take 4 just big, slow, deep inhales and exhales. And I usually tell people, if you're not calm after that, then maybe you need to go to the doctor, because that was a lot
Maybe you
of
have to go to the doctor.
that was a lot of regulating that you just did in 2 minutes or 3 minutes. Yeah.
You mentioned vagal stimulation.
Yes. So polyvagal theory is something that's really big in therapy right now, and it's also big in the longevity space. People are starting to learn where their vagus nerve is. Do you know where your vagus nerve is?
I don't. Tell me.
So your vagus nerve is actually a system of nerves, and it's all the innervation that comes off of your spinal cord, your cranial nerves, all those nerves that go into your organs, your intestine, your reproductive organs. And there's a lot of research now that vagal stimulation through devices that you can put on your neck, through cold therapy, that's why cold plunges are so all the thing, help to regulate vagal tone. And if we have better vagal tone, we have better mental health. We have less anxiety, we sleep better, we can regulate mood and interactions, we make better decisions. So when we do the cold splashing on the face, we're telling the vagus nerve that we're safe again.
That's really interesting. I was in a cold plunge last weekend, and it required progressive muscle relaxation and certainly paced
of course
breathing for the 15 minutes I was in there. And I love an ice bath, and I could certainly see the benefits from a muscle perspective, but it's so interesting about the mental side and what this idea of the vagal nerves. I mean, that's fascinating. I had absolutely no idea.
Yeah, and that's where the overlap between health, mental health, and
Yeah.
this and decision making is so critical. You cannot separate them, and everything needs to be working together, including your vagus nerve, in order to show up at a meeting the and be
Yeah.
your best self.
So, Rochelle, if I'm a family member and it has probably seemed clear to all of our family members that somebody in the family has borderline personality, and we've all struggled to deal with this. How do you begin to address that with your family member in a way that is, I mean, maybe it's using one of these strategies, but how do you actually say, hey, listen, I think we need to do something about this. Like, we can't let this go on without creating more of that negative self-talk that they might have. Oh, of course, like I've heard this, yes, I'm a loser, blah, blah, blah. Now I've got it. Like, how do you address it? What are some strategies?
So the one is call someone that you can have a conversation with about planning the conversation.
Okay.
So I think it's really important to plan what you're going to say to the person and think through if it's another family member, if it's an advisor or a therapist, how are we going to mitigate the risk of all those fears? You already have the fears of speaking to the person. So
Yes.
let's I just finished reading Never Split the Difference.
Mm-hmm.
So,
Correct.
right, negotiating
Yeah,
is
yeah.
it is a skill, and this is it, all we're doing is negotiating. So
Yeah.
get your points in order, find somebody to help you with a script. Um, the other thing is that when I say choose your words very carefully, we want to the first thing that we have to do to get people to listen to us is make sure that they're not emotionally charged, right? If the limbic system, if the emotional system is overactivated, they're going to back into a corner and not respond. So, is your approach like let's say they're saying hurtful things about themselves, or they're name calling themselves, or maybe they're even self harming, because self harm is a huge component to this.
Mm-hmm.
Um, so until you see that you have them in this safe and connected state with you, so you have to continue to talk to them in a way that puts them in a state of safe and connected. So I can that support and empathy, and you can't rush it. You just have to stay there until they feel safe and connected to you.
Are we talking days, or are you talking hours or minutes, or it just depends?
Well, that's the practice, right? Like if someone is exhibiting severe borderline personality, from moment to moment, you could be a good object or a bad object to them. So we want to catch them when they're feeling safe, and see if they will go and maybe talk to somebody about, don't you want to feel like this more often? I know that you want to feel good more often, and I know that you're in a lot of pain. So if you're going to write down something, I'd write the word validate. So you want to, just like, see, toddlers cannot name their emotions,
Mm-hmm.
right? So when we're suffering in this much emotional pain, we all, as adults, also cannot name our emotions. That's why people come to therapy. People come initially into therapy just for someone to sit across the room from them and say, I hear that you're really angry.
Hmm.
Ah, God, that felt better.
Yeah.
So stay with the validating until something connects. And emphasize who they trust. Are there advisors, are there people that they're really attached to, that's pretty consistent? Because sometimes, even if they're distrusting of a lot of other people, they've got that one friend, or that
Yeah.
one person that they really like.
Hmm. If I think about that individual that they really like, are in your experience, do you find that um, individuals with borderline personality do have somebody that they trust? And then my second question is, what makes that individual that trusted person? Is it because they just allow the behavior to continue, or because they can tell the truth? And if they can tell the truth, why is that person unique?
So I would say both, right? There's a positive attachment that can happen
Yeah.
there. The person who so we all want someone or something that allows us to feel consistently secure. Um, and if you're always able to be manipulated, every time I come around you, I can manipulate everything. Well, that's a secure experience
Right.
for me because I know what I know there's nothing uncontrollable about it.
Yep.
So that one is they might be able to be of help to get your loved one, into some sort of intervention, sure, because I don't manipulation is one of those things that I think gets a bad rap. I'm not saying to be manipulative, but I also think that when we call somebody manipulative, it's almost like calling someone, like blaming someone for being an alcoholic.
Hmm.
There are a lot of factors that go into being an alcoholic. Blame is not really the helpful stance when someone is suffering with an addiction, nor when someone is using manipulation. Kids use manipulation all the time. It's one of the first tactics we learn to survive in the world.
Yeah.
So, I'm not saying that it's right. It's actually culturally very frowned upon to be a manipulative person,
Hmm.
but it's just another coping strategy that we use to survive.
Yep. And it goes back to childhood. And if it worked back then and it continues to work, then why wouldn't you continue to use it?
And that's why holding a boundary and calling it out
Boundaries.
is like, we're not manipulating anymore. And another word that you can write down is reparenting. So parents don't like to think that they would have to reparent an adult child. Spouses don't like to think that they have to reparent their partner. We don't like to think that we have to reparent ourselves as adults. But that's maturing. That is when
Yeah.
we accumulate wisdom, we are reparenting ourselves on a regular basis.
It's not a failure from what was, it's a growth of what could be, and you just continue to learn and reparent.
Yes.
I've never thought or heard the concept of reparenting, but it really does make sense.
Yeah, and having kids is a great
Hmm.
catalyst for reparenting yourself.
I've noticed
So,
that. I've noticed that in myself. I have definitely had to explore some reparenting of my own. I
yeah.
just didn't know the term.
So, do you mind sharing what lessons kind of got relearned as you had kids?
Yeah, the sort of triggering moments for me, and how I respond to respond to frustrations, frankly. And instead of um sort of getting worked up, obviously with kids there are boatloads of frustrations and inconveniences in life and in the past. I've just sort of been able to work around those because I haven't had to, nobody was holding me accountable. I didn't have to navigate that with any other humans necessarily. You get married and you have kids, and all of a sudden it's like, okay, I need to learn to do this differently because my strategy right now doesn't work with my kids, and I've got to change. It's one example.
Yeah, and that patience is a type of a pain tolerance. And when we talk about pain tolerance in a personality disorder, they do not handle uncontrolled pain well. So the borderline mother who might have to tend to a child that's testing their patience, this is extreme pain. Whereas they might they may not know how to handle that kind of distress, but they could tolerate blackouts from drinking or cutting or an eating disorder. That type of pain is the controlled pain that gives them relief. So there's also this extreme with pain tolerance, and being able to learn how to be quiet and be patient, that's something that everyone can learn, personality disorder or not.
You know, I think about meditation and learning the art of meditation and learning how to breathe and be with your thoughts is such a powerful tool. And I never thought about it as building pain tolerance, but it really does.
Absolutely, it does. It allows us to pace and listen to our body sensations, or the cues that our bodies are telling us. And again, with this type of personality disorder, you're so disconnected from your body and its sensations. That's why you would go to the extreme of cutting or an
Yeah.
eating disorder, right? You want to have some connection and control there. So that what you described, Josh, I call the compassionate observer
Mm.
part. So we cultivate, and DBT does this. DBT does a lot of cultivating the compassionate observer. They call it wise mind. They have all these acronyms for these different skills that individuals that anybody can use.
Ruschelle, this is really helpful. I Hate You, Don't Leave Me, Walking on Eggshells, DBT. There are a lot of resources. We will post about this and make sure that these resources are available to people and putting them on Family.Inc, as well as trying to do what we can to drive more awareness, certainly on LinkedIn where everyone is hanging out. But any last thoughts or perspectives you might give to a family member who is struggling right now with a family member with borderline personality?
For that person, I would say really look and try to find some support for yourself, because there is when you're a part of that interaction. And when you get support to hold better boundaries, you're going to make your whole family system better.
Mm.
So, let's not just define this one person in the family with a problem,
Yeah.
right? We're a system and we're all working together. And so you're suffering. So you go and find someone who can hear your experience and then help you get the tools to be able to navigate somebody that you love.
I love that. That's fantastic. Ruschelle, thank you for joining us. I really appreciate it.
Absolutely. It was a great conversation. Thank you, Josh, for having me today.
Good. Thank you all for joining us. For more resources, check out Family.Inc for additional expert interviews and resources like this, which we will be posting on the site. Thank you very much and have a great day. Take care.